Dr. Theresa Tam is Canada's Chief Public Health Officer. Welcome to the show, Dr. Tam.
It's great to be here.
So flu, RSV, and COVID cases are on the upswing. We've heard from emergency room doctors this week. They say they're overwhelmed. How do things look from your vantage point? Do you think our hospitals can handle this respiratory virus season?
Well, the respiratory virus season is definitely well underway. As you said, there's co-circulation of many different viruses, including COVID-19, influenza, and RSV. I think the activity is always a bit different across the country, but as sure as winter comes, of course, respiratory virus season starts. And with this mix of viruses happening across the country and an already strained health system, I suspect that many hospitals and emergency rooms are actually very strained at this point, but it does differ depending on where you are.
Let's talk about COVID in particular. Just 15% of Canadians are up to date with the new vaccine. That's quite low. Vaccine take-up has dropped off considerably. What do you think when you see those stats?
I think it's really important to have everyone understands that the virus has not left us. It is continually changing, which is why there's an updated vaccine for this season, for the fall winter timeframe. We're constantly monitoring any shifts in the virus. But because of this ongoing evolution of the virus, it's important to get that updated vaccine. We call it the XBB.1.5 because your immunity does come down. And we're really most concerned about immunity against severe outcomes. And that's where our messages have really been trying to focus on people at the highest risk, particularly those who are 65 years and older. In that age group, the uptake is around 42% at the beginning of December. So there's definitely still room for improvement. And you can get the COVID vaccine at the same time as the influenza vaccine, because influenza is actually rising as we speak.
COVID politicized a lot of things, and some people would say it politicized public health and life-saving treatments. I was looking at a recent report from the Canadian Pharmacists Association, and they found that more than half of Canadians have vaccine fatigue. Do you think that that is being driven by how governments across the country handled things like the vaccine mandates?
It's difficult to know because as with any public health issue, it's complicated. I do think people are a bit exhausted. Some people have just had COVID, so they are not thinking about getting vaccinated. Many people think, well, they've had several vaccines now, they've had COVID, they're good. Well, in fact, the immunity does fall off. So I think it's a mixture of things. And I've also heard that some people find it a little bit more difficult to access the vaccine because during the pandemic, there were many special clinics set up. Local public health, really had to up the game in terms of trying to reach people. Now, the system is adjusting to have a more sustained approach, which means some of those specific measures are not there. But there has been an improvement in access, for example, at pharmacies and other points of vaccination as well. But I do think all of these factors just sometimes make it a bit more difficult for people to get the vaccine. And in fact, some of the people that we've talked to also said, well, we just kind of too busy or haven't got around to it. Well, I think this is the time to really sort of get around to it. Because we're heading into a season where I hope everybody will be able to share some quality time with family and friends. And often we will see an increase in infections around this time of the year to a whole host of viruses. So I think it's a mixture of different things. But I think it is important for public health to continue to just provide the facts so that people can make those decisions on those different layers of protection, including vaccination.
Let's switch gears to another topic. Your agency just released some data on opioid-related deaths. There were about 4,000 in the first 6 months of this year, and the data suggests they'll be just as high in the second half of this year as well. We're on track for the highest number of deaths ever recorded. What's driving this death toll?
You're talking about extremely perplexing and tragic public health crisis that has been so persistent for a number of years now. And one of the key drivers is this extremely toxic drug supply that's changed over the years. So initially, fentanyl got started in the mix of drug supply, and now it's fentanyl or its analogs are over 80% of responsible for over 80% of the deaths and they're from the illicit market. So, and the illicit market keeps reinventing itself. There's combinations of really deadly drugs. For example, since the pandemic started, we also observed an increase in benzodiazepines being added or mixed in with the fentanyl or opioid analogs. That is a really deadly combination. There are other combinations that have shifted over time and is increasing. So I think that is fundamentally one of the biggest issues that we're dealing with. Of course, there are many other factors because the populations affected have been experiencing lots of different socio-economic and other inequities. So it's really difficult to, get our head around this effort, but it has to be a whole of societal effort from every corner of the country and from every level of government and from society itself.
As you know, Conservative leader Pierre Poilievre has been critical of the Safer Supply program, which provides non-toxic drugs to those with an addiction. He says it's a failure, and he points to these ever-rising opioid-related deaths, almost are on track for 8,000 this year. Does he have a point when he pinpoints Safer Supply as a problem?
Well, I think just factually speaking, the mortality from the drug crisis is fundamentally vast majority are due to the illicit drug supply. It's very toxic. So we think that is a really key driver. And I think all stops have to be pulled basically to try and get through this. And any, treatment, harm reduction, recovery, and prevention. There's no one size fits all across the country and across communities as well. You really have to listen and learn from the local level as to what the specific solutions are. But if you think about the fact that, the illicit supply is always seems to be ahead of where the public health response is, I think heading into 2024, we really got to refocus on what else can we do. There's a couple of other shifts in the pattern of the crisis as well. I don't think that the Safer Supply is keeping up really with this horrendous toxic supply. So you're counteracting the really toxic lethal supply with something that is safer. Makes sense. So you have to collect data and move cautiously, I think, on this. But at the same time, some of the types of drugs being used is not enough really to counteract the parallel escalation in the toxicity. So I think we have to really come together again and think through this part of the response. But the whole continuum of the response is important. The other thing is there's a shift in the mode of consumption. So we saw a shift from injection drug use to inhalation drug use. And some of our support systems, including safe consumption sites, haven't quite adapted to that reality either. So I think again, heading into 2024, we need to rethink some of these measures. And again, it may not be the same from the east side of the country to west. The west end of Canada is most impacted by this illicit toxic drug supply.
We're running out of time, but I want to squeeze in this question. It's Christmas season. A lot of people will be drinking over the next couple of weeks, cracking open a beer, pouring a glass of wine. But there's really a dark side to alcohol that we don't really talk about that much. We talk about COVID, we talk about opioids, but there was 3,800 alcohol-induced deaths in this country last year. It's the leading cause of preventable death in Canada, alcohol. I mean, this is something that we maybe need to address more. Politicians don't talk a lot about it. Public health doesn't talk a lot about it. Do you think people really understand just how dangerous alcohol can be?
Yeah, I don't think there's enough public understanding. There's also a very normalization of alcohol being part of your culture. It's always linked to social gatherings and festive seasons. And of course, there's a lot of marketing targeting different populations, including one year when I was doing another report on preventing substance-related harms, these targeting of women, increase in alcohol drinking in women. And so the media, social media, the imaging of alcohol use is so pervasive. At the same time, people don't understand enough about the harms. So there's new guidance on safer levels of drinking. We're not asking people to stop, but be mindful and try and reduce if you can, and look at those guidance. But I think that the part that many people don't understand, I think safe driving, don't use alcohol and drive is something that has to continue to be persistently reminded, and cannabis use also. Use in pregnancy, of course. Pregnant women have to be extremely do not drink during your pregnancy. But it's cancers. People do not recognize that alcohol causes it's underlying risk factor for a whole range of cancer that affects males and females, and then mental health harms as well, and social and economic impacts. That's why alcohol is at the top of the list for drug-related harms in this country.
Mm-hmm. Let's leave it there. Thank you, Dr. Theresa Tam, Canada's Chief Public Health Officer. Appreciate your time.
Thank you for having me.
Thank
and
you.
Have a safe and happy 2024.